is natural capacity to expel it out. Cough is the very good sign in children, according to me, because even though children who are suffering from cough more than 10 to 12 days, also they are not reaching any school meetings, not upsetting anything. But after that, they're using some cough suppressants, immune suppressants, antibiotics. What happening? Due to the cough suppressants are not working properly, maybe histamine, leukin, interleukin, kinins. These are all natural suppressants, natural responses of immune system of the human respiratory tract. These are all very well managed natural response. After giving so many of other medications, they are losing their own natural activity. That's why what is happening, mucosal invasion. Actually what happening, there is a microbial agent landing into the respiratory tract. After mucosal invasion, it has to engulf and macrophage and throw it out through a expectoration. But not is possible in children with low vitality, low immune system, low upper respiratory tract development, and ciliary action of the upper respiratory tract is damaging gradually. Bacterial complications such as otitis media, acute sinusitis, and inflammatory sequels such as asthma. After what is happening, the chronic, untreated or not properly treated upper respiratory infection leading into asthma. Asthma is a acute exacerbation due to the narrowing of the bronchioles. The pathogenesis, recurrent respiratory infection is complex, involving anatomy and physiology of the respiratory system. When you call upper respiratory infection, I will call is recurrent respiratory tract infections, because the person coming regularly every month, every week, sometimes 2 months in a once, like that. Environment factors, impaired immunity. Here was the respiratory system, here was the focusing on the common conditions homeopathy physicians observe in the day and clinical practice: rhinitis, pharyngitis, tonsillitis. If you see 20 to 30 cases in a practice, if you see 10 persons, 10 children in your practice, there may be 10, maybe rhinitis, pharyngitis, tonsillitis. My aim and objective is to assess the benefits of homeopathic treatment with the upper respiratory infection, to assess the quality of life and children through visual analog scale in 2 levels. Review the history and physicians of patient with upper respiratory infection, outline the common obstacles in the homeopathy management of upper respiratory infections. Outline common obstacles. I found there is a common obstacle where we practice in a rural area. Vijayanagaram is somewhat rural area of Andhra Pradesh. There are surrounding more than 50 to 60 minute villages, hamlets. These children not receiving proper food and nutrition, and even no sanitation areas. But these are overcoming the sanitation, but not overcoming the poor nutrition. Government and all institutions providing the nutrition, but not receiving this nutrition. Study is unicentric, means OPD, MAHS, our hospital and my clinic also, for several cases. The cases are followed a minimum period of 6 months to 1 year. Some cases will found in 2 to 3 months also. After the follow-up, intensity of symptoms and assessment of the following grade through visual analog scale at 2 levels. Open label clinical observation, children to 2 to 12 years of age. Why? Because most of the kids are coming to OPD after taking so many of medications, after taking so many antibiotics, steroids, and all those things, after losing all the hopes in allopathic way or any other way, they are coming to the OPDs. Doctors, do something, because my baby is not going to school, even though going to school, not concentrating, not getting good marks. When teacher is saying something, baby is rhinitis, if it is possible to listen, to concentrate on the what teacher is said. Interventions are appropriate, individual homeopathy medicines in central potency, and the essential dietary measures include adequate daily intake of iron, vitamin D, and vitamin D through food. Inclusion criteria: 2 to 12 years of age, both genders, diagnosed cases of upper respiratory tract infections. Exclusion criteria: secondary causes of recurrent respiratory tract infection, maybe genetical, immune deficient, chronic, like that we excluded. Children who are undergoing any other ongoing treatment with chronic heart disease, children who are undergoing any ongoing treatment with interface with the homeopathic treatment. Any other treatment also, children are advised to take homeopathic treatment because some of the patients are not interested in taking complete homeopathy treatment, not relying on us. That's why we can advise that you can take both the treatments. This section provides the details of the case in the follow-up order, patient description, case history, physical examination results, the results of pathological other investigation, treatment plan, expected outcomes of the treatment plans, actual outcome. The presenter should ensure all the relevant details are included and necessary and included. Clinical data of these case series obtained from the observations of the treatment of upper respiratory infection by taking about 15 cases. These are analyzed and interpreted with respect to given medicines. Treatment results are basing on the visual analog scale. They are represented in the form of statistical diagram. Actually, it is missing. Actually, we have taken around 300 cases. We found relief of the symptoms with all the cases, but small time. But we introduced some nutritional supplement and vitamins, minerals, and educated the children with these. After that, sometimes, initially we failed recurrent respiratory infection, but after that, we called it as a upper respiratory infections because of these medicines, homeopathic treatment, plus nutritional supplements and educational to the parents. And given, we got good results, and among them we have taken only 15 cases. The observational study shows better outcome measured through VAS scale 2 levels, cough, seniority, and sinonasal symptoms. These are the predominant symptoms, cough severity and sinonasal symptoms. One or other, if the patient is better by cough, he will be suffering with sinonasal symptom. If the patient is better by sinonasal symptom, followed by cough. Actually, cough is a good symptom according to us, but even though patient is not having any complaint of fever, appetite, and all this, simple cough. Had adequate daily intake of iron, vitamin D, vitamin A within the range of recommended compared to the other. 1 minute. With this clinical study, view of effectiveness of homeopathy remedies, elimination of maintaining factors, adjuvant therapy showed better results in RRI with clinical outcome which measured through VAS scale. So we like to recommend necessary supplement along with the individualistic medicines, and this may be due to the limited period of plus number of cases, further research need to be through more late. My point is, if you see any upper respiratory infection or recurrent respiratory infections, you must advise history taking. Please advise supplements, vitamins, deficiencies. It will be better outcome than regular students. Conclusion, thank you for giving a great opportunity. My management, principal, students, faculty, and all. Thank you, one and all.
Thank you, sir. May I call upon the second speaker?